All right, wonderful. Hello, and thank you for joining us for today's virtual education program at Cancer Support Community South Bay. I'm Rebecca, the program manager, and I welcome you to this workshop titled Survivorship After Cancer. Now what? Before we begin, if this is your first time joining us, CSC South Bay's mission is to ensure that all people impacted by cancer are empowered by knowledge, strengthened by action, and sustained by community so that no one faces cancer alone. We serve the South Bay, Long Beach, and Orange County area all at no cost. Our program includes support groups, networking groups, healthy lifestyle classes, social activities, and educational workshop programs like this workshop. Educational workshops are open to all. If you'd like to hear more about our services or join a community, please visit our website at cscsouthbay.org. Without further ado, to our workshop speaker, Dr. Priya Mitra started her career in internal medicine and then transitioned to radiation oncology in 2007. She currently works at the UCI Medical Center and treats all cancers with a specialized focus in women's cancers. Thank you so much for being here with us today.
All right, thank you so much for that introduction. Let me share my screen. Great. So thank you all so much for joining us this evening. I really appreciate it. So the topic for today is survivorship after cancer. Now what? I'm going to start by just giving a little introduction about myself, and then we'll talk about general survivorship principles. We'll talk about preventative health and mental health, and we'll have plenty of time at the end for questions and answers. Feel free to submit questions if you have any via the chat. I believe that's open, and we'll go from there, but I'll try and pause in between so we can address any questions that may come up for you. All right, so just a little bit about me. My name is Priya Mitra. I'm originally an Ohio native. I trained a bunch on the East Coast. I was in internal medicine residency in Boston. I then went to Richmond, Virginia for my radiation oncology training. I worked in Philadelphia and then Los Angeles and currently at UCI, the Chow Family Comprehensive Cancer Center, pictured there on the top right. And that's our website in case you have any interest in exploring UCI health. So some general survivorship principles. So we have guidelines. I'm not sure if any of you are familiar with this. The NCCN, this is our National Comprehensive Cancer Network. They publish guidelines that are evidence-based on how we treat cancers. The neat thing is that they also have guidelines for survivorship, and that's what will be the crux of what we're going to be talking about today. So a lot of the slides have pulled information from there for your knowledge and just to generate discussion. So the definition of survivorship, it's basically an individual who's considered a cancer survivor from their diagnosis through the balance of life. This includes survivors living with cancer and those free of cancer. The panel that was generated by the NCCN recognizes that not all individuals with a history of cancer identify with the term survivor, but these guidelines are meant to be inclusive and use the term survivor to describe anybody with a history of cancer. It does include guidelines on the potential impact of our physical and mental state, as well as health behaviors and identity, whether it's personal, professional, sexual, or financial standing. So the objectives of survivorship care, basically there's 5 things that my job is when I'm following up with patients who are survivors after they finish their treatment. One is to make sure they're getting surveillance to rule out recurrence, whether that's scans, so like mammograms, CAT scans, PET scans, MRI scans, depending on the type of cancer that they were diagnosed with. Number 2 is we're screening for new cancers. Sometimes if a patient develops one type of cancer, they may be at a higher risk for developing a second cancer. For example, smokers, patients often will have, let's say, a mouth cancer or a throat cancer. They can come back with another cancer in that vicinity. So we're doing regular checkups for that. Number 3, we're trying to prevent and detect late side effects of treatments that patients have already undergone. For example, sometimes cancer treatments can actually be associated with other complications, lung issues, heart issues, so on and so forth, neuropathy. So those are things that we're watching for when we're seeing patients back in survivorship clinic or follow-up. Number 4 is to coordinate their care with their primary care physician and other specialists. A lot of times when, as you probably know, when patients are undergoing cancer treatment, we're seeing them on a regular basis. And what I mean by we is the oncology team. Gradually, we transition their primary care back to the PCP or primary care physician and other specialists. And number 5 is to promote healthy lifestyle habits as people post-cancer treatment get back hopefully into a new normal. So these are a list of concerns that a lot of survivors address or bring up when I see them in follow-up. And this is not just me, this is all comers. So this is a list that was compiled by the NCCN guidelines. So cardiac health, is my heart okay after treatment? Impact on mental health, anxiety, depression, trauma, distress, and we'll talk about that a little bit later. Cognitive functioning, is your brain as sharp as it was pre-treatment? Energy levels, lymphedema or swelling of one arm or one leg, or both arms or both legs. Level of pain control, hormone-related symptoms. Sometimes we'll induce early menopause in women. Sometimes we induce infertility. Sometimes cancer treatments can affect erectile function. So sexual health also goes along with that. Fertility can be affected. Sleep disorders can also be a consequence of cancer treatments. Healthy lifestyle is really important. Immunizations and infections, and employment, getting back into the normal groove of working if their patients were working prior to the cancer diagnosis and treatment. This is a very busy slide. We're not going to go through it all in detail, but I wanted to share it with you because I found it helpful just to kind of, for each of those categories that we just talked about, they're listed in the column on the left, survivorship concerns. There's 2 to 4 questions roughly for each category. And these are questions that we as healthcare providers can ask our patients. And obviously, I'm not going to ask every patient every one of these questions, but we tailor it to the type of treatment that they have. For example, if somebody had breast cancer and they had radiation to their lymph nodes, like the underarm, for example, I would ask them if they had any swelling, fatigue, heaviness, or fullness on that underarm or arm. Fertility, if somebody was considering family planning, excuse me, and froze their eggs, for example, what's the status of that and how is that impacting their cancer treatments and post-treatment recovery? I'll pause there before I move on to preventative health. Any questions so far?
If you have any questions, feel free to put it into the chat or unmute yourself and that indicate to me that you have a question to ask. I think we're okay. Thank you so much.
Yep. So preventative health, we have one question, it looks like. What about maintenance drugs? So I'm not sure if that means maintenance chemotherapy or maintenance in terms of hormonal therapy. So I'll address what I think that means, but feel free to specify more details. So for example, breast cancer patients often need to be on endocrine therapy like tamoxifen, Arimidex, or anastrozole. So that is something that we're certainly addressing when they're coming in for follow-up. Oh, I see, not a question, but thank you for highlighting these. Okay. PARP inhibitor, yeah, there's lots of medications that, especially honestly with the way oncology is advancing, there's so many more oral medications like tablets and pills that patients can take and need to take for longer periods of time. So yes, and those have side effects too. So that is definitely something that we're evaluating. How do I find out a doctor who specializes in survivorship? That's a good question. So, as a radiation oncologist myself, I never, we don't take any specialized training for survivorship. It's part of the job that you kind of learn as you go. That being said, more and more hospitals are developing survivorship clinics. So for example, historically, if I was treating a lung cancer patient, I would see them back in follow-up every 6 months. Right? And assuming that everything was fine, I would see them for probably anywhere from 2 to 5 years, depending on their risk of recurrence. Now, a lot of times though, in some of these hospital settings or clinical practice outpatient settings, what they're doing is creating a survivorship clinic, meaning the doctor will see the patient for, let's say, the first 1 or 2 follow-ups, and then they get transitioned to a survivorship clinic. So what I would ask about, wherever you're receiving your healthcare, is ask them if they have a survivorship clinic. Sometimes it's staffed by a physician, sometimes it's staffed by a nurse practitioner. If it's staffed by a nurse practitioner, it's typically overseen by a physician. So that way, if there's any issues that are picked up, then that can be brought to the attention of a physician. Are you mostly about assessing the situations or solving them? I mean, ideally, we want to do both, right? First is finding out that there's an issue and then figuring out ways to create a solution to help resolve them. For example, if a patient is on hormonal therapy, like tamoxifen, and they're getting hot flashes, there's things that we can do. But I can't help solve that unless I know what the issue is. So I can't emphasize enough. Honestly, if you walk away with nothing from tonight, I hope you remember to be an advocate for yourself and ask your healthcare providers about any symptoms that you're having. We're here to help, but it's hard for us to know, as I showed you, that questionnaire is pretty extensive. Patients get a lot of questionnaires when they come in anyways. So it's challenging to always identify every problem, which is why we work together with patients as a team. Because we want to be here to help support you through all these side effects that you may be experiencing. There's a good question about, is survivorship the same as palliative care, is how I'm interpreting it. So no, palliative care is technically a separate specialty. So those providers have done internal medicine and then subspecialize, typically internal medicine and then subspecialize in palliative care. The purpose of palliative care is to provide palliation, meaning of symptoms. So I have definitely seen patients back in follow-up, and let's say they have chronic pain, and the pain is a result of the treatment that they had from the cancer treatment. If I can't control the pain with the typical starting point for pain medication management, then yes, I'll send somebody to palliative care. I wouldn't necessarily send somebody to a survivorship clinic. Survivorship clinic, in my mind, is kind of more like a maintenance follow-ups to make sure that things are okay and helping to screen and catch any potential symptoms that they have post-treatment. Palliative care, often it goes hand in hand with hospice, but they are separate specialties. So hospice is more like a subset under palliative care. So palliative care doesn't have to be an end-stage patient as opposed to hospice. Palliative care is really there to help manage symptoms, chronic symptoms that are as a result of the cancer, whether they're actively going through treatment or they are post-treatment related symptoms. I hope that answers your questions. All right, I will keep, okay, great. All right, I will keep going and I'll pause again shortly. Okay, so next I wanted to spend most of the time talking about preventative health, at least for the slides. So I like to really empower our patients because I really think post-cancer treatment, there's a lot of nervousness, a lot of trepidation about how do I get back to normal? And I think there's a lot of uncertainty. It's interesting. I find that patients feel more nervous after they finish their treatment. They're nervous at the beginning of the treatment. This is the average patient. Obviously, there's exceptions. They feel nervous before starting treatment. They get comfortable with it. And then when treatment's done, they feel like, well, what else do I do? Now I just feel like I'm waiting for the shoe to drop or just waiting for something to happen. But the beauty of that scenario is you've completed your treatment. You've done everything you can do. But now there's more that you can do. And these are some of the categories that are identified in our guidelines in survivorship. These are all things that you have in your control. We all have in our control. How active are we? Our nutrition, sleep, alcohol, tobacco use, sun exposure, weight management, screening, stress management. And so I wanted to we'll go through most of these. So let's start with physical activity. And again, these are tables and guidelines from the NCCN that I started with. So examples of physical activity, they divided up into light exercise, moderate exercise, and vigorous exercise. So light exercise, no change in your breathing pattern. So just going for a leisurely walk or a leisurely bike ride, doing some basic yoga, Tai Chi, doing some light housework. It's some sort of activity. You're not sitting, but your breathing is also relatively stable. Moderate exercise. You can talk, but you wouldn't be able to sing. So some, forms of line dancing, some sports like baseball, softball, volleyball, Pilates, pickleball, more intense yoga, moderate intensity, some gardening, doubles tennis, those a brisk walk, water aerobics. These are moderate activities that we would include. So vigorous exercise, you can barely say a few words without stopping to catch your breath. So this is where, instead of doubles tennis, it's singles tennis, or climbing upstairs, going for a fast-paced, race-paced walk, swimming, high-intensity yoga, jogging, hiking, boxing. I think you kind of get the sense of the three main categories. So the guidelines for survivors on general principles of physical activity. Now, these are pretty lofty goals. but I think they're good to be aware of. Survivors should strive for at least 150 minutes, which is 2.5 hours of weekly activity, with an ultimate goal of 300 minutes or more of moderate intensity activity. So that's that middle category where you can talk, but you couldn't sing, or 75 minutes of the vigorous intense activity. That's where you have to catch your breath if you want to have a conversation in the midst of that activity. This is over the course of a week. So if you think about, 150 minutes sounds like a lot, but that's 2.5 hours. So 30 minutes a day for 5 days a week, that would meet that goal of moderate exercise. Also recommended is engaging in 2 or 3 sessions per week of strength or resistance training. That would include the major muscle groups, stretching your muscles, ideally before you do endurance or aerobic exercise, and trying to incorporate core exercise and balance training, especially older survivors and those at risk for falls. I also can't emphasize enough how dangerous falls can be in elderly patients in general, or older patients in general, but especially as we all age. Our balance is really, really key and critical, because it can lead to hip fractures, which can lead to hospitalizations. And if you have underlying bone involvement, let's say from your cancer, they can be really quite detrimental. One more thing on a couple more slides on physical activity, and then I'll pause to answer the question. Resistance training. So the frequency that's recommended is 2 to 3 times per week, trying to take breaks between sessions, so you're not doing it 3 days in a row. The intensity, trying to do 2 to 3 sets, 10 to 15 reps, and increasing weight as you can tolerate. And then resting in between sets and exercises. For survivors who want to start resistance training, it's really, really helpful to work with a trained professional or exercise specialist or a personal trainer to guide you, just so you can do it in a safe manner, and utilizing weight that would be appropriate. We don't want to go out and start lifting, 50-pound weights if we've never lifted weights before. If you have a history of peripheral neuropathy or nerve damage from prior treatment, that can increase the risk of dropping your weights. So also making sure that you've got supervision, or you're working with other things that are safe, whether it's machines, that way there's not a risk of it falling onto you or slipping, or using resistance bands. Lymphedema too, if, for those of you who may have either know someone or have experienced lymphedema, that's basically typically arm swelling or leg swelling, very common, or relatively common in breast cancer patients. I'll refer patients to the lymphedema clinic. It's a subspecialty of physical therapy where I work, and they're wonderful. So they can also teach you some stretching exercises, some massage techniques that you can then incorporate into your physical activity routine. So you may be wondering, well, some of these goals seem pretty challenging to achieve, especially if you have work and family and just life in general. So these are some strategies that you could use to help increase your physical activity. One is, when we recommend treatment for doing some increased physical activity, it does work probably 50% of the time. Sometimes we can get patients excited about it, especially if we emphasize the importance. Working with a trainer or a specialist. Starting to go to classes. That's also a really nice way to explore it. The YMCA has great classes. A lot of the local gyms have classes as well. Zumba, walking groups, working with a partner. So if you have a friend or family member who's interested in exercising as well, that can be really helpful. Like an exercise buddy. Wearing a fitness tracker like a Fitbit, that can also be motivation too, because you see the calories that you're burning and how many steps you're taking. Also tracking your habits too, keeping a journal of how often you're exercising can also be quite motivating as well. Last slide on physical activity. So again, survivors with established, these are the different categories that may require special consideration. We briefly touched on lymphedema. Survivors with an ostomy, important things for them to know, which we will typically remind them, is, you want to make sure your bag is empty before you get into exercise, especially if it's something vigorous. Monitoring how carefully you are doing your core exercises if you've got an ostomy. Those people who have a limb prosthesis or have a limb amputation, it's helpful to work with physical therapy, occupational therapy, or a trainer who has expertise with those types of patients. Peripheral neuropathy, the balance is really, really critical, because they're at a higher risk of falling. So things that are a little bit safer, lower risk of falls, would be a stationary bike, water aerobics, yoga, wearing special footwear might be helpful. Doing resistance training might be helpful, of using things that are a little bit safer and don't cause discomfort when holding them in their hands. If patients have had bone loss or had cancer has spread to the bone or bone metastases, you want to be careful with, where are you lifting weights? What kind of weight exercises are you doing? Making sure you're getting enough supplemental vitamin D and calcium. And older adults, again, making sure the patient is strong enough, and we don't want to overboard what they're doing, have them, go too aggressive. And it's okay to start slow and build up. There's no need to, try and do 300 minutes of moderate exercise a week when you've not been doing anything. Just slow, progressive steps really do make a difference. I'm going to pause here, and there's a couple questions. Please address the feeling like I will have to be looking over my shoulder for the rest of my life. No, I hear that all the time. Honestly, it is extremely common. I wish I could take that feeling away. What I try to do is encourage patients to do their, I'm not gonna lie, that feeling is probably never gonna go away 100%. I think it's learning how to live with that feeling and learning to focus on these things that we're talking about, right? The fact that you control what you can control and have faith that the treatment worked, and really outcomes of cancer treatment is getting better and better. I think keeping up with your activity, your nutrition, your sleep, your stress levels, and going in for checkups is probably the best way that I know of. Also, support groups are really helpful. I've had a lot of patients who, go to survivorship support groups, so breast cancer survivor group, prostate cancer survivor group, and I think that is also really helpful because patients have told me they feel like they're heard, they feel like they meet other people who are feeling the same thing that they're feeling, and it makes them feel like they're not alone. And you can help support each other more than anybody, right? Because you've gone through similar experiences, and I think that's really powerful. Where do we find out more about SL's lymph.B? I'm not sure if that means lymphedema. Ashley, if you could help maybe elaborate there, if that's what you're asking. 300 minutes is 5 hours a week of moderate. Yeah, it does seem like a lot. I agree. I mean, and this is 300. Yeah, it does seem like a lot. And again, that's why there's a range of 150 minutes to 300 minutes, right? I think the key is start slow and see how you do. I have a friend who runs 7 miles a day, probably about 5 times a week. So she's easily running and doing the 300 minutes of severe exercise. So it does seem like a lot. I totally agree. I mean, I'm thinking even myself, I would have a hard time keeping up with that. But I think start with the goal of 150 and see how you feel. If you find an activity that you really love and enjoy, and it brings you, that rush of endorphins, and you're feeling happy and feeling good with it, then I think that's something that you could then pursue. I see what you're asking. I have that I didn't include that in the slide in terms of the S-lymph-B, but I'm happy to pull it up afterwards if you would like. What if you were doing this before diagnosis? Does this help with lowering future risk? We're going to talk about nutrition as the next question. What if you were doing all this before diagnosis? Does it help with lowering future risk? Yeah, it does. And we're going to tie into that with the physical activity, because it all correlates with BMI, like your weight management, nutrition. So yes, I'll hopefully address that as I keep going through the slides. So yes, let's talk about, we're actually, good segue. We're going to go to nutrition next. Okay, so nutrition. There used to be the food pyramid several decades ago, and it has transitioned over time. So this is the typical plate that's recommended by myplate.gov. I think, there is a lot of stuff out there in terms of what's the right nutritional regimen to use, and we'll touch on that a little bit. But this is a great resource. This is a good starting point where I would go. Balancing your plate to have It's roughly, I believe, here we go down here. So vegetables and fruits should comprise half the volume of food on the plate. 30% is vegetables, 20% fruit, whole grains about 30%, and on protein about 20%. So, you know, a meat and potatoes with no fruits and veggies is probably not the best meal. Again, we'll go through some more examples. Eating the rainbow. I don't know if you've heard of eating the rainbow, that phrase before. I love it. I try and remind myself of it every day. Basically, the goal, and I don't meet this goal every day, but I try my best, is to eat the rainbow, meaning eat a color, every color of the rainbow every day. Now, I'm not talking about Skittles and I'm not talking about M&Ms, but we're talking about like fresh, actual food, non-packaged food, for example. So red apples, strawberries, oranges, cantaloupe, yellow for bananas, yellow squash, green, I mean, there's so many greens, broccoli, spinach, mustard greens, green beans, blue for blueberries, purple, I guess beets are kind of in that category, but I hope you get what I'm trying to get at. You know, the key, if you have one big salad, you could easily get all those into one bowl. If you've got a nice mix of contents in there. So nutritional goals. So the one thing I think is fair to say is that favoring a plant-based diet has been studied and shown to be associated with longer life longevity. I don't know if you're familiar with the blue zones. That's something that you could look up later if you're interested. There's been a lot of published data on that. The blue zones are regions of the world that have the highest concentration of people above the age of 100. And so they've studied these populations. One's in Japan, one's in Italy, one's Loma Linda, and I think the fourth one is Greece. But they looked at, you know, these are all very different cultures. The one commonality is that they all had a relatively plant-based diet. That doesn't mean vegetarian, that doesn't mean a keto diet, that doesn't mean fasting, that just means a plant-based diet. Meaning, yes, you can have meat, but more fruits, veggies, beans, and whole grains. Monitoring our portion sizes and caloric intake, and be cautious with intermittent fasting. You know, intermittent fasting has gotten a lot of press recently. I think it can be effective for many people, but you must be careful, especially, you know, depending on your other diagnoses. For example, diabetics, I know, struggle with intermittent fasting because they need to keep their blood sugar at a constant most of the time. So that's something to be really careful of. I would talk to your doctor about it. You could even talk to a dietitian about it. Excuse me. There's different ways to do intermittent fasting. Myself, for example, I eat 2 meals a day, whether that's lunch and dinner or brunch and dinner or breakfast and dinner. And that works for me. But, you know, I make sure that I have good meals for those 2 meals. Some people follow 16 hours of fasting, 8 hours of eating. Some people follow, you know, there's other variations of it, but that's something to explore. But again, under the direction of a professional, ideally. So things that we want to limit, red meat has been shown to be associated with cancer as well as processed meats. So we really want to limit how much we eat. The recommendations are less than 18 ounces per week of red meat. Processed meats like cold cuts, like deli meats, we also want to minimize those. Those have been associated with gastric cancers and colon cancers. Trying to avoid chips, cookies, candy bars, and all the good stuff. You know, it's okay to indulge. We all indulge. We want to live. We want to enjoy food, but it's trying to not habitually eat these things on a daily basis. Refined sugars, the goal is to have less than 6 teaspoons or 25 grams if you have a 2,000 calorie diet. So what does that mean? So that means if you have 3 medium cookies in a day, that's your daily max. If you have a 12-ounce can of Coke, that's 10 teaspoons of sugar. That's technically almost double what the recommended dose is, or how much sugar is. So I'll pause for questions here. Since we're not sure about what causes cancer, how can we be so authoritative about what to eat to prevent it? Good question. You know, I think a lot of this stems from what has been shown to be associated with longevity. So if you're practicing nutritional habits that are associated with longer life, I think it's fair to extrapolate that and apply it to cancer patients, right? I mean, if they've had a health issue, I think it's a reasonable starting point. But honestly, I do refer a lot of my patients to dietitians because they're more knowledgeable about that. And I think they're a great resource in terms of how to modify your diet. Now, that being said, there are certain things that are associated with cancer, right? Like eating a high diet in red meat and or the processed meats, it's been linked to like GI related cancers, colon cancers, rectal cancers, stomach cancers, bowel cancer. So there are some correlations already established, but you're right. I mean, we can't say that we know that nutrition causes all types of cancers. What are good sources for calculating appropriate portion size and caloric intake? Great question. I think working with a dietitian is probably appropriate because they have the ability to guide you on that. One of the things I've explored the blue zone diet and just that whole lifestyle that I mentioned earlier. One of the things that as a kind of a rough rule of thumb is that you want to make sure in terms of portion control, it's helpful to stop when you're about 80% full. If you're at a Thanksgiving dinner and we are, natural to kind of overeat, by the time you feel full, you're going to feel even more full, in about 20 minutes, 15, 20 minutes. So as a starting point, that may be something just to pay attention to. When you're feeling about 80% full, that's been shown to be helpful. Now I'm sure that there are online calculators that, putting in your age, your height, your weight, you may be able to get a rough starting point of a caloric intake. And I'm sure there's lots of apps on this too. But I would say ideally, I would lean towards starting and meeting with a nutritionist or dietitian. Are there specific diets optimized for specific cancers? Good question. I'm not a dietitian, so I'm not 100% sure of, a list of things. I can tell you that there are certain things, like for example, if I'm treating a throat cancer patient, I don't want that person eating like a tough steak or tough meat, overcooked meat. I don't want them eating things that are really dry. Those are things that I've customized diets. But more specifics, I usually have a dietitian involved. A lot of departments, mine included, have a dietitian on staff as part of the oncology team. So if you're plugged into either a survivorship clinic or a oncologist, I would ask to see a dietitian and they can do a evaluation and give you some guidance. Are turkey slices without nitrates still considered processed? I think so. I think the nitrates is the key word there though. We'd want to avoid things that have nitrates in them. But again, a good question for a dietitian, but in general, a rough rule of thumb, again, remember, predominantly plant-based diet. I think, moderation is the key. Is it okay to eat turkey slices? Sure. Would I eat it every single day? No, probably not. Another tool that I've learned from dietitians that they'll sometimes recommend is like a meatless Monday, or pick 1 or 2 days a week where you don't eat meat as a way to try it and see how you feel. I eat meat, but that's something that I follow, and it's been really helpful for me to kind of explore non-meat plant-based options. Can you refer to documentation regarding red meat? I don't eat processed meat, but I've seen doctors argue for carnivore or keto. Documentation regarding red meat, I mean, this recommendation that I've even quoted here, the less than 18 ounces per week, is from our guidelines. That's where all these are coming from, everything that's on these slides pretty much. So that's what I would point to. Carnivore versus keto, I don't know. I am a believer in the plant-based diet, but again, I would talk to a nutritionist or a dietitian to explore that further. Rice crackers, I don't know if they're considered processed. I mean, I think the key is to try to avoid things that come out of a box or a bag, and I think technically rice crackers probably are processed because they're manufactured in a plant. It's not like, or in a factory, it's not like it's a natural thing. So the key is to try and incorporate as many fruits and vegetables and beans and whole grains as you can. Okay, let's, chicken, salmon, tuna, or cheese. The same thing. I think I'd have to defer to, I think chicken is a white meat, salmon is fish, and tuna as well, cheese. Again, moderation is the key. All right, I am going to keep going, probably take the rest of the questions at the end if you guys are okay with that. I want to make sure we get through all the slides.
Thank you so
Alcohol.
much, Dr. Dr. Mitra.
Yeah, of course. So alcohol, we want to drink sparingly if possible. So I found that I always find this interesting. So normal intake, the definition of normal intake is for women or females, 1 drink or less per day. For men, 2 drinks or less per day. Now, binge drinking is defined as 4 or more drinks in one sitting or one night or day for a woman, and 5 or more drinks in one sitting for a man. So, again, moderation is the key. It's okay to take drinks. It's okay to enjoy. It's okay to have 2 or 3 if you want to, here and there, but on a regular basis, the recommendation is no more than 1 drink a day for a woman and no more than 2 drinks a day for men. If you've had any of these diagnoses, these are directly linked to alcohol intake, so you really want to avoid alcohol if you can. Liver cancer, esophageal cancer, breast cancer, colon cancer, head and neck cancer. Smoking really falls into these categories as well. Smoking is related to many esophageal cancers and head and neck cancers particularly. Let's shift gears to weight management a little bit. So I don't know if you guys are familiar with a BMI or body mass index. This is just a screenshot. If you Google BMI, this is the website that you'll probably be taken to. It's a BMI calculator. I would encourage you all to plug in your numbers. Basically, you put in your height, you put in your weight, and it calculates your BMI. Now, normal BMI is between 18.5 and 24.9, and that is the goal that was in our survivorship guidelines. It's also the goal for normal weight for normal for all adults. And so it gives you a guideline as to where you fall. Now, is this perfect? No, absolutely not. Some people maybe running marathons and be slightly overweight on the BMI. It's not a perfect system, but it's a nice starting point. I remember I used this many years ago when I first discovered it, and I was surprisingly, I didn't realize I was in the overweight category, and it was just kind of a wake up call of, okay, it's a starting point from which I can build on increasing my physical activity and building, a healthy weight. To manage your weight, caloric intake or portion control is key. Going to that myplate.org, physical activity, and watching, modifying behaviors. What time of day do you eat? Are you a late night snacker? That used to be me, and that was a quick fix that I was able to cut down my weight just by doing that one simple change. What food choices are we making? Are we doing exercise? How often are we doing exercise? Next is sun safety. So daily sunscreen of SPF 30 plus is what's recommended. And again, a lot of these guidelines apply to everybody. And I think that's my takeaway is that really survivorship, we're treating survivors the same as if the cancer never existed. We want to be proactive about screening and making sure that they're living long, healthy lives. Reapplying sunscreen every couple of hours, avoiding tanning beds. And then if you're going to be out in the sun for a long period of time, wearing protective clothing, wearing a hat, wearing long sleeves, just, making sure you're wearing sunscreen. Moving on to sleep. These are the recommended guidelines. We'll spend a little bit here talking about sleep, 7 to 9 hours per night. And of course, everybody has different tolerances. Some people can get away with 5 hours a night. I don't know many people, but some people can just function on less sleep. But the average adult typically needs 7 to 9 hours. Different guidelines for adolescents, 8 to 10 hours typically, so longer for them, and older adults can often sleep a little bit less. So I'm not sure if you I wanted to share this in case you're not familiar. This is called sleep hygiene. So what sleep hygiene is basically, we have hand hygiene, which is like hand washing. Sleep hygiene is habits that we can use to make sure that we sleep better. So for example, maintaining a regular bedtime and wake time. So of course, if you're going to have maybe on a weekend, if you have a party or some sort of social gathering, you may not, go to sleep and get up at the same time every day. But the more consistent you are, the more regular you are with your sleep patterns, the more likely you are to sleep better. Engaging in physical activity. I think that's another advantage of the physical activity that we talked about earlier, is it helps you sleep better too. Now, if you want to avoid doing strenuous activity right before bedtime, but in general, if you do it, if you have a little bit of a gap between your physical activity and sleep, that often will help you sleep better. Exposure to daytime bright light in the morning can help you wake up. Reducing exposure to bright light at night, it can help you fall asleep. So, I know a lot of people fall asleep with a TV on or computer on or on their phones. Ideally, the book says for sleep hygiene to try and reduce exposure. and take a break from screens before going to sleep. Trying not to eat heavy meals or drinking lots of fluids, especially alcohol, right before bedtime. Limiting caffeine consumption too. You know, you want to have at least 4 hours if you can between your last caffeine consumption and bedtime. Try to create a nice sleeping environment where it's comfortable, it's cool, it's an environment in which you feel almost like a cocoon. You want to try avoiding looking at the clock when you wake up in the middle of the night. I know this has happened. It happened to me even last night. I woke up in the middle of the night. I checked the time, and it was hard for me to fall back asleep. Napping is fine. Of course, listen to your body, but try not to take prolonged naps because then that can interrupt your sleep patterns overnight. And avoiding electronics, as I mentioned earlier. So, you know, if you try sleep hygiene and it doesn't work, there's other things that you can try. You know, and these are listed here in terms of, you know, relaxation techniques, limiting how much time you're spending in bed, maintaining a regular sleep schedule, you know, stimulus control, just having the bedroom or where the bed is only a place for sleep, for sexual activity only, you know, trying not to have TVs or computers in the room if you can help it. And you know, if you do, and you maybe just try, even if you have a TV in your room, try turning your TV off and say, okay, I'm gonna, you know, half hour before bed or an hour before bed, no TV, and see how you sleep if you're having trouble sleeping. On a related topic, sexual health. So this can also be affected by cancer treatments. It can just be affected by aging, but cancer treatments in particular can affect it too. So I have 2 symptom checklists. This one is for women, the next slide is for men. I would encourage you to talk to your healthcare providers about it. I do routinely ask all my men and women patients who have treated the pelvis about their sexual function every time I see them back in follow-up. A lot of times patients have a hard time bringing it up or hesitate bringing it up, but it's really important to bring up with your healthcare providers. This is our job. We're here to help you. Don't be shy. And, you know, there's things that we can do to help you. Lubricant, there's actually, there's a specialized type of, it's called pelvic floor rehab. I'll send patients there. So for example, after pelvic radiation, if they're having difficulty with libido, orgasm, or just anything in related to sex, they can be really helpful if they go to the pelvic floor rehab and, you know, gaining access to exercises that can help them really get stronger and regain some of the function. It's not all of their function. So this is the sexual health inventory for men. It's called the SHIM score. We typically give this to all the prostate cancer patients. So 5 questions, and they rate it on a scale of 0 to 5. Really specific questions, asking about erectile function, ejaculatory function, those types of things. Again, really important to have this conversation, I think, with patients. All right, the last main category I wanted to touch on was mental health. So we're going to talk about depression, anxiety, and panic. So I want you guys to look through this list and kind of do a self-screening for the next 3 slides. So the definition of depression, again, this is all from our NCCN guidelines and survivorship. The definition that they've outlined for depression is for the last 2 or more weeks, how often do you have at least 5 of the following most of the time? Feeling depressed or hopeless, loss of interest or pleasure in most activities, you know, weight loss or gain without really trying, disturbances in sleep, psychomotor agitation or retardation, meaning you're just feeling really agitated and almost like overly excited, or really, really just sluggish and slow, lack of energy, feeling worthless or having excessive guilt, decreased concentration or feeling indecisive, or having thoughts of death or suicide. So if you've answered yes to 5 or more of these that you feel, look, we all have these feelings, but if it has lasted for more than 2 weeks and more than half the time, the majority of the time you're feeling this, then this really warrants a further follow-up conversation with a healthcare provider or a hotline. And I have got a resource later that I'll share with you to make sure that you're getting checked, and, you know, there's things that we can do to help improve this. The next screening tool is anxiety. So excessive anxiety or worry that is difficult to control. If you're feeling that and you have at least 3 of the following: you're feeling really, really restless or on edge, really easily tired, difficulty concentrating or your mind just goes blank, feeling very irritable, having muscle tension, and sleep disturbance. Again, just because you answer yes to 3 of them doesn't mean or 3 or more doesn't mean that you have anxiety, but it means that you may. And again, it's worth having a follow-up conversation. And then the last one, in terms of mental health, I wanted to touch on is panic. So panic attacks, right? So if you have sudden intense fear or discomfort that peaks within minutes, and you have at least 4 of the following. So palpitations or pounding heart, feel like your heart's racing, sweating, trembling or shaking, sensations of feeling smothered or just short of breath, like you can't breathe, pain in your chest or discomfort, nausea or abdominal stress, like you just feel like you're going to throw up, fear of dying, feeling dizzy or lightheaded or unsteady, chills or heat sensations, paresthesias, numbness or tingling, feelings of unreality or being detached from oneself, fear of losing control. So if you met the criteria on the prior slides for depression or anxiety and or panic, please speak with a healthcare professional. I put here a hotline, 988 Suicide and Crisis Lifeline. You can call, you can text, you can go to their website anytime, and they can provide you resources. You're not alone. We're here to help. There's lots of resources. If you don't feel comfortable talking to your healthcare provider, you can talk to, I believe you can do this anonymously. So it's just a nice place to go. So that's the end of my slides. And just in summary, I just wanted to say, survivorship is really the start of regaining your life back in a new way. And look, I'm not here to say that you're gonna let go of that feeling of feeling like you're always looking over your shoulder. But I'm hopeful that you feel a little bit of hope that you do have some things in your control. And it's important to keep up with recommended follow-up visits and all the tests that they're recommending, and doing your best to control nutrition, physical activity, and weight management. Managing mental health and sexual health are really important as well. And please, I encourage you to talk about that with your healthcare provider. And I just want to say thank you for your questions and your attention. For everything. I really appreciate it.
And thank you so much.
Let me, if you'll excuse me just a second, let me just check one. I got a quick message from work. Still at work. Okay, great, nothing.
If there are some questions in the chat already, but if you do have any more questions, we do have some time. So you can put them into the chat, or you unmute yourself, and then that'll just indicate to me that you have a question you would like to ask orally, verbally. And thank you again.
Yeah, of course. So first question.
That was such a wealth of information.
Good. First question, does no alcohol include adding wine to food while cooking, or only to drinking it? I think the guidelines really refer to drinking it. I'm not super familiar with cooking with wine. I don't really do it so much. I imagine that it's not a lot, not a high quantity. So I would imagine that that's probably okay. Now, if you're adding wine to all your meals every single day, it's probably not a great idea, but again, moderation. But I think to answer your question, I think the guidelines really pertain to drinking. Have I seen a circadian rhythm disorder as a result of cancer treatment? I don't know if I would call it a circadian rhythm disorder, but I've definitely seen a lot of cancer patients have sleep trouble during treatment and post-treatment. So that is definitely a real thing. I don't know what the classification criteria are, to be honest, for a circadian rhythm disorder. But that's why I wanted to share about sleep hygiene, because I think that's a good starting point. I didn't really get into it, but if that doesn't work, which it doesn't work for everybody, if that doesn't work, there's also medications that you can use, and there's sleep specialists that you can see and talk to. Palliative care, if you're plugged in with them, they may be able to help with that as well. Travel is good for mental health, but will throw off health habits. Yep. And routine. And I'm terrified to go to Europe, but need to see my family. Is it okay to stray from healthy habits for a week or two? Absolutely. Listen, at the end of the day, we all need to live. We all need to find balance. This is not about, we're not in school. We're not following assignments. These are guidelines, right? This is meant to be a way that you can strive for, something you can strive for. But the mental health benefits of seeing family and traveling, I couldn't agree more. I encourage you to find that balance. And listen, when you're in Europe, you might find ways to, go for walks. If you're jogging or running now or swimming now, maybe you could just go for walks, and that's still activity. It's interesting in the blue zones, these people who are over 100 years old, a lot of them don't go to the gym. It was really interesting. What they do is they bike, right? They bike to the market, or they walk, they take stairs. It doesn't have to be 300 minutes a week. it really just being active and just trying to avoid being sedentary is, I think, the key. I follow almost all of these recommendations and cancer still happened. Yeah, no, I mean, and that's I'll be honest, I mean, I find that so humbling. You know, it's like I see many patients where they follow the rules and they still get diagnosed. And the only thing that gives me peace of mind is to know that, you know, at least you know that you've been doing everything you can. Some of this is chance. Um, you know, some of it is not in our control. Like, for example, breast cancer, right? The biggest risk factors for breast cancer are being a woman and increasing age. And we can't change either of those things. Other things are hormonal exposure, estrogen exposure. So, you know, but again, by the time the diagnosis happens, you can't change that, right? You can't change if you took birth control pills or not. You can't change what age you were when you first got your period. You can't necessarily change if you never got pregnant. You know, so I agree, it's discouraging and frustrating that, you know, we can't, at this stage, we can't stop all cancers from happening, but all we can do is control what we can control. Can treatment throw off thyroid? Yes, absolutely. So it depends on what type of treatment you get. So in my world, and from a radiation perspective, whenever we treat head and neck cancer patients, those patients often get hypothyroid or low thyroid, meaning they need thyroid supplementation. So yeah, so that's something I routinely will check, like if they, you know, because if their thyroid is in the area where we gave radiation, we'll check thyroid levels. I usually get a baseline before we start treatment and then get a check about 6 months later, because it can take up to 6 months for that to be affected from radiation treatment. And can it get better? Yeah, I mean, with supplementation, usually it can normalize and symptoms can really improve.
Wonderful. Thank you so much. If there are, we do have a couple of minutes left. If there are any other questions, please feel free to again put them into the chat. Yes, Linda, go ahead. Linda, feel free to unmute yourself if you'd like to ask your question. And if, oh, go ahead. Okay.
I don't mean this as contentious as it's going to come out, but you've invited the hard questions. And so I want to say the first two things I was told and that everyone else I've talked to was told about breast cancer was, one, you've got to be your own advocate, and two, avoid stress. And in my experience dealing with both Torrance Memorial and Cedars, those two instructions are contradictory. The most of the stress has come from the bureaucracies you have to deal with. And in order to be your own advocate, you have to speak up and fight City Hall sometimes on things like scheduling or types of tests that you want or don't want. And is there any way we can address the industry, so to speak, and say, stop being such freaking bureaucrats? You're supposed to be helping patients, not causing us more stress.
Yeah. Yeah, no, I agree with you. You know, I feel stressed seeing patients navigate, and obviously it's nowhere near as much stress as I'm sure patients feel. But no, I agree. There's too much red tape that patients have to jump, and hoops that they have to jump through to be advocates for themselves. And I find it frustrating. I share your frustration. You know, I know that
it's not just the hoops that exist. It's the people resisting you trying to jump through the hoop.
Yeah.
It's the bureaucrats. It's the people. It's treating medicine as a compartmentalized, nobody wants responsibility. I've had the same doctor for like 40 some years. He's in his 90s and he still thinks really well.
Yeah.
And I could ask him about any subject and either he would look it up or send me to somebody who knew the answer. Now, if you ask a question that isn't in their lane, so to speak, all you get is, you know, go back and ask your PRP. Well, that's not the most helpful kind of answer. And the amount of compartmentalization that I have experienced and the amount of needing to be a cookie cutter and having to do standard of care, even when you know that you're an individual and your experience has been that standard of care isn't always the right thing for you. The amount of flack you get from people who don't want to take responsibility for anything but their own lane has been driving me crazy. It's just very stressful, and it doesn't need to be.
Couldn't agree more.
Thank you for sharing, Linda.
We need more patient ombudsmen.
Yeah.
I just included a quick snapshot, the request about the lymphedema survivorship. So this is just a screenshot from our guidelines on specifics for patients with lymphedema. Hopefully that's helpful and you can see it.
Okay. Thank you.
I can't see it. I can do this. I can share my screen real quick maybe, or,
I got the direct message from you.
oh, did I send it to you?
Yes, I can send it. I can send it to Ashley. Or
Perfect.
I can post it to everybody.
Yeah, that'd be great.
Yes.
Thank you.
And thank you again, Linda, for sharing.
And I
I
appreciate
think everyone here would agree with you. And there's an amen in the chat as well.
Thank you. I'm not just going by my own experience.
Absolutely not.
My assistant was primary caregiver for his grandmother who just died at 104. Now, if she made it to 104, she knows something about her body and what it needs. And he had the same experience of having to fight to get even the most basic thing like copies of reports, even though he was
Yes.
her medical surrogate.
Yes.
Just because it's so freaking bureaucratic.
Yes. Thank you again, Linda, for sharing. I'm so sorry to hear that. For time's sake, I would just like to ask Sarah a couple more questions if possible. Sandy, you had your hand up.
I also see that there's 2 questions we haven't addressed.
Okay. Sandy, if you'd like to unmute yourself at this time, please go ahead. Okay, go ahead and answer the questions. And I'll go ahead, Sandy.
You answered it. Thank you.
All right, wonderful. Thank you. Sadai? Sarai? Am I saying that correctly? You're on mute.
Thank you. Yes, I have a question. Like, I feel my energy is not the same. I'm 29. I was diagnosed at 28, and I feel my energy is not the same. And it's hard for like work because I'm just so tired. And I come home and I sleep. And if I don't sleep like 8 hours or 9 hours, I just can't work or function like very well. So
Yeah.
is it gonna be like this always, or it's gonna be better with through time?
Hard for me to know for sure without knowing the details of your medical history. I would say most people that I've treated who have energy decline during and after treatment, it typically gets better with time. And I do find that the patients who are more physically active, and again, you don't need to go out and run a marathon, but just slowly incorporating physical activity should help you regain some of that energy as well. And then nutrition makes a big difference too, right? If you're eating, I'm not saying you're doing this, but if you're eating, sugary cereals and, fast food for every meal, that also can make you feel very sluggish. So, I think focusing on the other things of nutrition, activity, those things will be helpful.
Thank you.
Yeah.
Yes. And this workshop is recorded, so I did put my email in the chat for anyone who would like a copy of it, just to review at a later time as to what they like to incorporate into their, everyday lives. Do you have a couple more minutes, Priya,
There were
for a
2
couple more questions?
that I didn't
Okay,
get.
okay, perfect.
One was share long-term side effects of breast cancer radiation. I already have lymphedema, but wondering if there's anything else to look out for. So, with breast cancer radiation, it's interesting. I don't know if you had left-sided or right-sided breast cancer radiation, but that can make a big difference, potentially make a big difference. So, the heart is on the left side, so patients who have left-sided breast cancers, that's something that we are more cognizant of trying to find ways to protect the breast. So there's different techniques. I don't know what you've had. We can do breath hold technique, which helps minimize heart and lung radiation exposure. Sometimes patients are treated on their belly, so where the breath kind of hangs down. That can also help. But lymphedema, I think, is the most common, probably late side effect. And skin changes, that can take some time for that to recover. So I would encourage you to hydrate the skin as much as you can. And I hope that answers your question. Any tips on employment or returning to, she said left. So yeah, that's the one thing I would just ask. This is for Viviana. I would ask your doctor, your radiation doctor, if they're worried at all about your heart and lungs, or if they were able to minimize that on your radiation treatment plan. And then also just modifying what you can in terms of cardiac risk factors, right? Making sure you're getting your cholesterol checked, making sure your blood pressure is under control. Sandra asked a question, any tips on employment and returning to work? I would say listen to your body, right? It all depends on what type of work you do. Is it physically draining? And if it is, then I would take your time going back. Most people that I treat, I encourage them to work through treatment if they're able, because I feel like it's almost like mentally, it gives them a distraction in a way or something else to focus on. I find that motivates people and gives them more balance. Otherwise, it can be very easy to focus on the cancer and the cancer treatment, which can then weigh really heavily on their mind. So I think working is helpful. Now, again, just take your time, and depending on the type of work that you do, take your time doing that. And also, don't hesitate to ask your provider. I do this all the time. If a patient needs, FMLA, needs to go back part-time or do modified work hours, then we're happy to help support that. Let's see.
There's also an organization called careersandcancer.org that may be able to have some tips and resources as well. And there's one last question, if you're able to answer it.
The Roma question?
Yes.
Yeah, so seroma after lumpectomy, we're talking about breast cancer, most of the time it just resolves on its own, truthfully, with time. If, I've had a handful of cases where the seroma is large, and in those patients, I'll send them back to the breast surgeon, and then they can aspirate, meaning remove the fluid, and then that helps kind of decompress it. But usually you don't have to do any kind of intervention. It just takes some time and it resolves.
Wonderful. Thank you so much, Priya, for being here with us, and for everyone for being here with us today.